Station number 1. Scenario of X-ray of abnormal thumb. What will you ask in history? Details about symptoms, that is anemia, shortness of breath, palpitations, repeated infections, petechiae, bleeding from nose, mouth or any other side, failure to thrive, loose motions, nail dystrophy, hair loss, pruritus, lymph node enlargement, hepatosplenomegaly, previous history of upper respiratory tract infections, drugs and radiations, history, family history, developmental history, residence area, nearby factory. What will you check in examination? Height, weight, FOC, any dysmorphic features, abnormal facies, skeletal abnormalities, particularly upper limb and thumb, anemia, jaundice, petechiae, bruises, air discharge, oral thrush, signs of malnutrition, lymphadenopathy, organomegaly, skin hyperpigmentation, that is cafe au lait spots, microcephaly, cryptorchidism, mental retardation, deafness. What are differential diagnoses? FANCONI anemia, Diamond-Blackfan syndrome, TAR syndrome, Holt-Oram syndrome, Schwann-Diamond syndrome. What's the diagnosis? FANCONI anemia. How will you investigate CBC? All three cell lines will be decreased with low retic count, with peripheral smear, bone marrow aspirate and trephine biopsy. Marrow cellularity will be decreased, aplasia. CD55, CD59 immunophenotyping to exclude PNH, paroxysmal nocturnal hemoglobinuria. Cytogenetics and chromosomal breakage study to detect myelodysplastic syndrome, MDS, FANCONI anemia and dyskeratosis congenita. HB electrophoresis, HbF will be increased. Other investigation for renal, cardiac, hearing, skeletal, genitourinary, etc. What are treatment options? Repeated blood transfusion, antibiotics for infections, GCSF, granulocyte colony stimulating factor and erythropoietin, immunosuppression with corticosteroids and androgens, hematopoietic stem cell transplantation. Hematopoietic stem cell transplantation only curative for hematologic problems, supportive for example hearing aid, treatment of renal problems, orthopedic, malignancy, etc. What's the prognosis? Most respond to androgens, but treatment is long term. Patient not responding to immunosuppression usually die within a few years due to pancytopenia, complication or malignancy.